I'm Sarah Adkins. I'm a pharmacist. I am working on the Southeastern Ohio QI Hub project. And today joining me is Michal Searls. And Michal is certified as a health literacy specialist and also creates continuing education for healthcare providers, which I think is really cool, healthcare professionals, which I think is awesome. So my question for Michal today is, talk to me about health literacy. What is health literacy?
Well, thank you for having me today, Sarah.
You're welcome.
I really enjoy being here and being at Rising Suns Pharmacy.
Thank you.
This is a great experience. So health literacy is how people find, use, access, and understand information and how they're able to use it to make informed decisions about their health and their health care or their health and well-being.
Fantastic. Thank you. So for the providers watching today, what is important for them about health literacy?
Something to keep in mind about health literacy, we should use Teach Back.
Okay. Tell me more about that.
Teach Back, you explain a prescription to me.
Okay.
And you tell me you explain to me how I'm going to take the medication, and then you pause and ask me, hey, Michal, when you go home today and you're talking about your family, what are you going to tell them about your visit? How are you going to take the medication? And I practice on you. So you're not testing me to see if I memorized everything.
That's what I was going to ask you.
You are just checking to see if you explained it in a manner in which I understand.
I like that. And so it's important for me to know what I told you was correct. Okay.
Yes.
That's fantastic.
Yes.
That's a good way to remember it instead of thinking the patient needs to memorize the information.
Yes.
Okay, fantastic.
So you generally hand them something as well, but you've explained it so then when they go home, they understand what it means.
Okay, awesome. Yeah. Tell me more about what our providers might want to know about health literacy to help their patients.
So another thing that we should keep in mind is keeping information in plain language.
Okay.
Medical terminology is medical terminology,
okay.
Right? So for example, if you are talking to me about hypertension medication,
yeah,
you can explain it to me, Michal, this is your medication for high blood pressure.
Yeah. Putting
it in perspective in terms that I can understand and easily remember.
Okay, that's fantastic. So what else? Is there something else we could do with maybe pictures or something like that?
Absolutely. So plain language is having information at a 6th to 8th grade reading level.
Okay.
However, with medical information, it's important to keep it closer to the 6th grade reading level. The 8th grade reading level is actually the average age of Americans.
Okay, sounds very good. Anything else you want to share with us about health literacy today?
I think one thing that we could keep in mind is health literacy is not limited to any specific socioeconomic, cultural, or education status.
I love that.
There are many instances where a person may be very educated and, for example, not know what a formulary is.
Yeah, right.
And I know that's something very important in a pharmacy.
Right.
Or for health insurance.
Right.
People don't understand what a formulary is. And that's not everyone, of course, but that's just an example. However, you may have some with no formal higher education. You know, maybe they've completed high school or maybe not.
Yeah.
But they may understand or have experienced more than what someone with a master's degree would.
That's fantastic. That's such a great point. I think that's easily forgotten. So that's fantastic. I think in the pharmacies, this is also important. So one of the things that Michal and I wanted to share today was talking about prescription labels for our patients. There's an example in front of us, and it contains quite a bit of information. The piece that I would like to focus on are actually the directions for the patient, the quantity, and the drug information that's actually on this prescription.
Can you explain this to me? I see that it has a description of what it is. Can you explain this to me? I mean, that's a great part of health literacy in itself, is just being able to understand what that medication is and what it's for.
I think that's a fantastic question. Michael and I were just having a conversation too of how nice it would be if we could actually put a picture of the tablet itself onto the prescription label. That would be fantastic. I'm not sure our software systems are up for it, but I think it'd be fantastic. In place of that though, currently what we have is most labels will contain what the imprint is on the tablet itself. So the imprint on a prescription drug, the imprint on the tablet is unique to that particular pill. So drugs.com is a really excellent resource for providers and patients. And there are so many different generic manufacturers, and the pill can look so different that I think it's important that these resources are available for everyone to look at. So on drugs.com, you can actually put in, on the drug identifier, you put in the imprint that is on the tablet, the color of the tablet or pill, and the shape of the pill. And it can tell you what that medication is, exactly what that med is.
Wow. That's great.
It's cool.
So what is this number here?
Perfect. So the NDC, which is on every label, is a national drug code. That's what that stands for. The first 5 digits of the NDC are the manufacturer of that product. Oftentimes on the label, you'll see the manufacturer on there as well. The next digits on that NDC are unique to the drug and the strength. So that is a really important part of the NDC, is that second set of digits. The last 2 digits are strictly for bottle size. They come in different bottle sizes, 30, 90, 100, 500. So that's what those last 2 digits are. You can actually use that NDC as well to pull it up on the internet and look for what that drug is.
So you have 2 different ways in order to identify a pill or a tablet.
Yeah. I think it's pretty fantastic. Great. The last thing I wanted to point out on the prescription label is the no refills piece of this. I think is pretty hidden on the label, and many patients don't even notice that they have no refills left. I know this can be a pretty big piece of contention for whether the patient calls in for the refills or the provider calls in for the refills. It can be a pretty big question. So I just wanted to point out that it is not very clear on there, and maybe between the pharmacist and the patient determining who is responsible for calling in those refills. There's also a discard date that actually is 1 year after the date of the date that the prescription was written. It's technically when it expires, or sooner. So that's what that date is on that prescription.
But the medicine could, for example, expire before the year.
Absolutely. Absolutely. Great question. This other label, so different pharmacies can have different looking labels. This one is included just to show the difference in what the labels may look like. This is actually one that's a label specific for CVS Pharmacy, just as another example. It gives some important information, still gives the same information we were looking on from the previous one. This one actually does give the imprint on the label. Well, I don't see an NDC number on here, which is fine, but they give the imprint, and you can find an NDC number from the imprint itself too.
So did you say before, maybe this was in conversation that we had, did you say that the information, most of the information on here, it's mandatory for them to, for the pharmacy itself to put that information on the label?
That's such a great question. So yeah, most of the information on the label is either a federal or a state standard, and they're required by either the State Board of Pharmacy or the federal government to have that information on the label.
Okay.
So this one is one of my favorites. So most pharmacies are able to change the language on that label, and oftentimes can make it maybe large print as well. So this one is one that Michael and I have discussed quite a bit. This is a label that's actually in Spanish, and Michael has a great story about this. This is why we wanted to include this one.
I do. So in a discussion group, in a focus group I was involved in, and actually I've heard that this has occurred since then with something else. There was a label, and it was in English. It was for a Spanish-speaking patient, and it said, take once daily.
Which
Now-
is not uncommon.
Correct.
I use that a lot.
Correct.
Not anymore.
Now, the patient read it as once. In Spanish, once means 11. So they were taking this medication, and it happened to be a blood pressure medication. Yeah. So, they're into their third day. They had 30 days. They're into their third day, and they're out, and they're very, very sick.
Yeah.
Luckily, they were just very, very sick. However, they read it as once, take 11 times daily instead of once a day.
I think that's a huge problem. I think that the miscommunication can be a serious problem.
And I think that's another important part of our discussion with health literacy is, again, making sure that the patient understands the label, understands how to take the medication before they pick it up from the pharmacy, so that they know what their doctor said as well as what the label says, and they know it's one time and not 11 times.
Fantastic. So I think this is a great example. We can actually put the prescriptions in Spanish. I encourage the providers that if you know that the patient speaks a different language, to include that in the note to the pharmacy, that may be an issue, or that we need to put it in Spanish for the patient. We also have patient information that gets printed with each new prescription that also can be put in Spanish or a different language. So letting us know is great.
Did you want to talk about this particular, the Humalog?
Yeah. So I think something that we talk about is it's often called a sliding scale. I was taught correction factor, but that also, sometimes there's a lot of information that needs to go on a prescription label. So to fit all that information, I think a sliding scale is something that we discuss frequently. Several of the physicians that I work with do such a nice job, or providers I work with do a really nice job of relaying what that scale looks like for the pharmacist to put on the label. So this one is actually a really nice example of what a sliding scale or correction factor could look like. To inject 1 unit of 10 grams of carbs before breakfast and dinner, and then 1 unit per 12 of carbs before lunch, plus the sliding scale of 1 to 50 for over 150 on their blood glucose when they check it, max of 45 units a day. So that is really helpful for me as a pharmacist to get all that information on there for the correct quantity to dispense as well.
Well, thank you for providing all of this information today. It's been great talking to you. I learned a lot about prescription labels. I have learned how you have introduced health literacy, how you use it in the pharmacy, not only for you, but for your patients and the providers.
Thank you. Thank you for sharing about health literacy too. Just do a quick summary, not to forget about teach back, plain language, and maybe pictures. That might be really helpful.
Yes.
I'm going to take that away as well for the pharmacy. So
Thank
thank
you.
you for giving your time today.
You're welcome.
Have a
Thanks
good
for
day.
having me.
Take care.
See ya.